Hi. Yes, I do. I have one for a colleague. So nearly 12% of people in British Columbia who've died from COVID likely contracted the virus in hospital, according to Ministry of Health statistics. Acute care outbreaks continue despite your guidelines on how to prevent them. Why are there so many, and what more will you do to prevent them, especially in this phase of the pandemic with Omicron?
Yeah, well, I think it's very clear that acute care outbreaks can spread quite rapidly. And part of that is patients who are coming in from the community who have undetected disease, and then it's detected after it's spread within the hospital system. And just today, the hospital outbreak at Abbotsford was declared over, thankfully. And so we've been doing a number of things. I think if we look at the number of people who have what we call nosocomial or hospital-acquired COVID infection, it's a very small percentage of the overall number of people that have had COVID, and it's heavily weighted to earlier on when we didn't have as robust screening and we didn't have the vaccination. So we have continued to have smaller, much more contained outbreaks in the last few months. And there are a couple of things that have made a huge difference. One is the fact that all healthcare workers now are vaccinated, and that means the protection that they have and the protection that they have from patients who may be bringing COVID in with them, and the very high vaccination rates that we're seeing in our communities. And also, more recently, we've seen the effect of the booster doses. The people who were getting breakthrough hospitalization were generally older people with more compromised immune systems. So this booster dose has made a difference in that as well. So that is not the only thing. The other important things, of course, are paying attention to personal protective equipment. That's why we do require people to wear masks at all times in the hospital, both healthcare workers and visitors. The fact that visitors need to be vaccinated to come into our hospitals, because we recognize how challenging it can be, particularly in some of the wards. As well as there's been a lot of attention paid to appropriate infection prevention and control precautions, including ventilation in particularly some of the older facilities. So it is a combination of infection and prevention and control measures, on the increased vaccination, on the healthcare worker vaccination policy, and the vaccination that everybody is getting in the community.
Just one short thing to add, Binder. We have today, as of today, 4 acute care outbreaks in BC. I think maybe 3 after Abbotsford. 2 long-term care outbreaks active in BC, and 1 in assisted living. The 2 long-term care ones are at George Derby, at Peace Villa, and then 1 at Laurier and Prince George. And you see the effect of mandatory vaccination here. Compared to where we were before. In the end of October, we had approximately 20 long-term care outbreaks, 6 acute care outbreaks, 3 acute assisted living outbreaks. So the impact of the measures that have been taken, both mandatory vaccination, booster doses, and the efforts that have been made with respect to visitors, have had a real effect. In long-term care, of course, just about all of the residents are vaccinated, the vast majority now 3 times. Staff have all been vaccinated 100%, and visitors are all vaccinated. It's slightly different in acute care because, of course, a disproportionate number of new patients related to COVID-19 are coming into the hospital and vaccinated to get the care that they need. But that said, the steps are effective, and what we're seeing is, especially in long-term care, and nobody, I can tell you, is more grateful for this than me, but than anybody who knows anybody in long-term care, to see that we're down to a small number of long-term care outbreaks. And obviously it continues to be a concern at George Derby and Peace Villa, but you can see the progress that's been made in part related to these measures.